Hello, welcome to video 3 in my knee replacement video series. In this video I'm going to talk about the immediate post-operative period after surgery. So this is going to cover the first few days whilst you're in hospital and the first couple of weeks once you get home. Now, when you wake up after surgery, you're going to be seeing the physiotherapist very quickly afterwards. And the reason for that is it's really important to get yourself moving and get yourself up out of bed as quickly as possible. So you will always be talked through these one-to-one with a physio, but so that you've got some idea of the kinds of things to expect, I'm going to go through those exercises now. So all of these are on the website. There'll be a link below. I'm just working through the sheet that we have here, and you can download these for yourself. So after any kind of orthopedic surgery, there is a risk of what's called a deep vein thrombosis, which is a blood clot collecting in your calf muscle. That can be a very dangerous thing, and if it travels around the body, particularly if it gets into your heart or your lungs, it can be potentially fatal. So it's very important to make sure that that doesn't happen. Often you might wake up and you'll have these like an inflatable pump on the bottom of your feet, and that's to help the circulation of the blood, and you yourself can help the circulation of your blood with ankle exercises, basically just twiddling the ankles up and down like so. And you need to be doing this regularly, at least every hour, if not every half an hour, or basically whenever you think about it, just to get those muscles working. You'll have a scar down the front of your knee, quite a big scar, possibly with staples in it, and that scar is going to pull when you exercise, but don't worry, it's not going to burst open, it's quite secure, and as I've already mentioned, it's really important to get your legs muscles working as quickly as possible. So the first one is static quads, which is basically where you just tighten your thigh muscles as hard as you can. Pull your toes up, pushing the back of the knee down into the bed like so, and then release. So tightening up, back of the knee down, and release. The next one is grab a ball, is inner range quads. We put the ball behind the knee like so, 30-degree bend in the knee, and then we're just lifting up like so. Now, immediately after surgery, you will probably struggle to get your foot up off of the bed, okay? Don't worry, it's because the thigh muscles are all inhibited. Your knee's been through a lot of trauma, so don't be too concerned if initially you can't do this. Work at it anyway. Eventually you will be able to do this, okay? And just lift up, get the knee as straight as you can. Often what will happen, initially you can only lift it an inch off the bed, then 2 inches, and then eventually you'll be able to get it all the way up to the bed and get the knee straight. Now, when I first qualified 20 years ago, it was very common for people to wake up with what's called a passive movement machine, which was their legs strapped into this device that was bending and straightening their knee, and that was fitted as soon as you came out of theatre. And so you'd wake up, literally wake up from surgery with your knee bending and straightening and bending. We don't tend to use that quite so much these days, although some surgeons do still use it, but it's very important that you do that movement for yourself. So it's literally just sliding up and down as much as you can. Now, it may be that you have to help yourself slightly, so putting your hand behind the knee just to assist, because there's a good chance when you first do this you're going to have drains and dressings all around the knee. It's going to be difficult to do, and when you first do it you might only get 20 degrees bend, but do 20, then do 30, then 40, and just keep working it so that you get the knee bend. And what you're aiming for is to get over 90 degrees bend in the knee. going to turn over the page. Okay, so on the exercise sheet, it talks about using a towel, which you can do. You could put a towel around just to help you, assist you, or what I tend to tell people to do is put their hand behind the knee. But you could use a towel just to help pull the knee up. So for the first day, those are basically the kinds of exercises you'll be doing. After a few days, you'll be getting up, well, I say after a few days, in fact, probably the first day after the operation, you'll be getting up and standing up. But the following day, you'll certainly be up, moving around the room, moving around up and down the corridor, and the physio will start to get you doing squats and standing exercises. So you need something to support yourself. So the back of a chair, a windowsill, a handle, or like the stair rail, anything just to support yourself. And you're just going to squat down, bending the knees as far as you can, and back up. Now, initially, you might only bend them 10 degrees. That's fine. Each time you do it, you just get a little bit deeper and a little bit deeper. Okay. Other standing exercises to try and get your hip muscles working is to extend the leg backwards behind you, keeping the knees straight, lifting the leg out to the side, and the other one is to lift the knee up. Obviously, by lifting the knee up, you're going to be bending the knee and working that knee. Okay. Look at the next page on my list. It's important that your knee is straight. It can be tempting to sort of support your knee with a pillow behind it when you're in bed at night. The problem with that is you could end up with what's called a flexion contracture, where you can't fully straighten the knee. So it's very important that you try and stretch that leg out straight. And one way of doing that, when you're resting in your chair, is you would have your leg up on a stool like so, nothing behind the knee, and just letting the legs straighten out like so. The other thing is you'll need ice after the operation. Often you get like an ice pack to wrap around the knee, and that can be good because it can ice the knee, and the weight of the ice pack can help to try and stretch the leg out straight as well. Now, you'll be going up and down stairs after around about 3 days of surgery, assuming you've had no complications. You'll be up and down the stairs after 3 days. The thing to remember, you'll have crutches, you'll have a handrail that you can hold on to, is the saying we always physios say to patients is the good go to heaven and the bad go to hell. So on the way up the steps, you always step up with your good leg first. On the way down the stairs, you always step down with the bad leg first. And the reason for that is on the way up, you want the good leg taking the strain. On the way down, you want the good leg taking the strain again. So by stepping down the bad leg first, the good leg is having to lower yourself down. Okay. So those are the kinds of exercises you'll be expected to do in the first few days and the first sort of couple of weeks after surgery. In the next video, I'm going to show the exercises you would do a week to 2 weeks after surgery, so more advanced knee exercises. Thank you.